Hi, I'm Craig Stevenson, Technical Consultant with Elanco. Today I'm going to share some tips about how to apply CompuDose implants. Good preparation, hygiene and implanting technique are essential to get the most from your investment in CompuDose. Here are some simple guidelines you should follow every time. First, clean the applicator and needles and ensure the needles are sharp. Place them on a tray in a safe area near the head bale. Make sure you've got a sponge soaked in disinfectant that's been diluted to the recommended concentration to clean the needle after each implantation. You'll also need a brush and a bucket filled with water and disinfectant so you can clean any ears that are dirty. Keep implants sealed in their original packaging until ready for use. Restrain the animal in a suitable crush, chute or head bale to prevent injury to yourself or the animal. Identify the implant site. Ideally, the implant should be administered to the back of the middle third of the near side ear. Sometimes if there is a management tag that has already been placed in this area, it may be required to administer the implant in the middle third of the ear, either above or below the management tag. Ensure the ear is clean. Only if the ear contains mud or manure should it be cleaned using a brush or sponge soaked in disinfectant. Make sure the ear is dry before implanting. CompuDose 400, 200 and 100 are implanted using the blue CompuDose applicator. To load the applicator, pull the plunger button backwards until it clicks. Remove the protective cover from the implant cartridge and slide the plastic sleeve and leaflet off the cartridge. Insert the cartridge into the applicator. Push the plunger button forward until the implant lies in the barrel of the needle and the plunger clicks into position. Grasp the applicator in one hand and the ear in the other. Be sure to position your index finger across the underside of the ear rather than along it to avoid a potential needle stick injury. Position the needle flat on the ear about 4 centimetres or the full length of the needle from the desired implant site, taking care to avoid blood vessels or cartilage. Insert the needle at an angle just under the skin. Be careful, inserting the needle at too steep an angle may result in the needle going through the ear. Push the plunger button all the way forward and then pull the needle back slightly. Secure the implant between your thumb and index finger. Withdraw the needle in one smooth motion, keeping the plunger pushed forward. Now, palpate the ear to ensure the implant has been correctly placed and retained in the ear. Seal the needle insertion site by applying pressure with your thumb and index finger. Now mark the offside ear with an approved triangular ear punch. Disinfect the needle after each implantation to avoid the introduction of bacteria to the next animal implanted. Clean and disinfect the needle with the plunger extended and wipe the needle across the sponge. This will prevent any contaminants accumulating at the tip of the needle. Change the disinfectant solution regularly. The end of the needle contains an indent designed to maximise implant retention once the applicator is loaded. When the needle becomes dull, use a new one. Alternatively, the needle may be resharpened by hand using a sharpening stone. To reload the applicator, pull the plunger back until it clicks, advance the cartridge to the next position and push the plunger forward until it clicks, and then repeat the entire implanting process. Disassemble and clean the applicator at the end of each day's use. Unscrew the collar, remove the needle and plunger, and then gently prise the handle apart. Wash all the parts in warm water and disinfectant to remove any manure and dirt. To reassemble, place the plunger in the channel on one side of the handle. Attach the other side of the handle and screw the cap on loosely. Insert the needle with the bevel facing upwards and tighten the cap using finger pressure. Finally, wrap any discarded needles and empty cartridges in newspaper and dispose in a sharps bin or general rubbish. Store any unused implants in a sealed plastic container in a locked cupboard at room temperature or a refrigerator. Thanks for watching, and remember, never sacrifice good hygiene or implanting technique for speed. If you have any questions about CompuDose, please contact your nearest Elanco representative.